Hi, I am Dr. Anantaraman, consultant, Arudra Homeopathic Specialty Center, Chennai. There is a very good understanding nowadays globally and more importantly in India about the contributions of homeopathic medical system towards public health care. But there are certain important contributions which are yet to reach the public in the proper context. To understand this, we need to know what is a superbug. We all know there are many microorganisms like a virus, bacteria or a fungus which can cause an infection in a human and cause certain diseases. Out of these organisms, some organisms are very virulent and can cause a serious healthcare problem, while the remaining can be very innocent. They may not cause a disease every time, or even if they do cause an infection or a disease, it will be very simple and very amenable to any present-day medical care. But imagine if these innocent looking innocuous organisms suddenly turn into a very virulent organism causing a very serious healthcare disorder which doesn't get controlled with any present day medication, then we call them as a superbug. There are many reasons for the formation of a superbug. Let me illustrate a few. Indian public has been very common in repeating the prescriptions what was given to them earlier. Many times they'll repeat the same prescription for a similar disease which was given a few days or a few weeks or months back by a doctor, presuming that the same medications hold good for the present clinical issue too. But they may not be true. There can be inappropriate medication leading to a drug resistance. The second scenario is the doctor would have prescribed a course of medicines for a week or 10 days or so. But this person, after consuming medicines for 2 or 3 days, and he feels better, he thinks medicines are enough and stops the medication midway. Such stoppage of medicines midway actually contributes to mutation in the structure of the virus or a bacteria or fungus, turning them from an innocent organism to a virulent organism, leading to a drug resistance. Nowadays, certain section of medical practitioners prescribe antibiotics even for a viral infection. There can be many reasons for this, but prescription of an antibiotic for a viral infection is always uncalled for. Even this inappropriate prescription of antibiotics for viral infections can lead to a mutation in the structure of the organism, leading to a drug resistance, finally ending up with the formation of a superbug. Prevention of superbug is easier, whereas treatment is very cumbersome, sometimes even impossible. How homeopathy helps? Homeopathy helps in the prevention of superbug because homeopathic medical system helps in a lot of viral infections. In fact, they are very successful in curing many viral infections and certain bacterial infections also. Usage of homeopathic medicines appropriately in treatment of viral infections can go a long way in preventing the gene mutation of the viral or bacterial or fungal structure and prevention of drug resistance, in turn prevention in the formation of a superbug. This contribution has gone unnoticed in the eyes of public, government and even a section of medical practitioners. Once we understand this contribution, the importance of contribution, the healthcare, public health care can be very can make a great use of this contribution of homeopathy. Let's be more aware of the healthcare options and be more proactive towards our health. Thank you.